Hello everyone, nice to meet you again. Today we will learn a new disease, that is pulmonary infective disease, pneumonia. In Chinese it is called 肺炎. We know that there is an epidemic of the novel coronavirus pneumonia in China. So we have to start the lessons online. But at the beginning of this class, I would like to tell you another story of SARS epidemic. In December of 2002, the first case of the SARS presented with cough, high fever, and dyspnea. And when the doctor arranged the CT scan for him, they found that there are initial change in both lungs of this patient. Rapidly, this patient deteriorated into respiratory failure and need for mechanical ventilation. This picture shows the This picture shows the invasive mechanical ventilation for this patient. And furthermore, most people who have close contact with this patient got the same symptom with him, especially the clinical workers. And all of them were diagnosed as severe acute respiratory syndrome. For short, it's SARS. Between 2002 to 2003, the SARS transmitted to other 31 countries all over the world. And finally, most of the patients can be cured, but with a sequelae of pulmonary fibrosis and bad pulmonary function. Finally, the WHO concluded that the SARS is a viral pneumonia which caused by the coronavirus, the SARS coronavirus. Okay, here shows the contents of this class, including the introduction, clinical manifestation, auxiliary examination, diagnosis, and treatment. And finally, I will show you some types of pneumonia. And now, let's look at the definition of pneumonia. Pneumonia is the inflammation in distal airway, alveoli, and lung interstitium, which can be caused by so many causes. It's complicated, right? Yes. And I think we can try to find some key points to help understanding. It's complicated, right? Yes, I think we can try to find some key points to help understanding. Okay, let's look at the first key points. It's about the location of the inflammation. If the inflammation occurs in the distal airway or alveoli, we can find some cloud-like opacity in lungs, as the red arrow showing. Those are the aerospace opacity. And if these opacities become more and more, and finally they will confuse to consolidation opacity, as this picture showing. And both of the image shows the parenchymal infiltration. But in the other side, if the inflammation occurs in the interstitium, we also can find this frog-like opacity in lung. Those are called ground glass opacity. And it belongs to the interstitial trench of lungs. And the differences between these two kinds of image is about the boundary of the opacity. About the aerospace opacity, we can find the boundary of the opacity is clear, right? And here is clear. But the boundary of ground glass opacity is unclear when the infection occurs in the interstitium. But all of these images will show a suspicion of the infection. Another key point of the definition is about the cause. We know that the pathogenic microorganisms is the most common cause of the pneumonia, including the bacteria, viruses, and fungus. But we cannot neglect other causes of the pneumonia, such as physical or chemical agents. For example, if the lung cancer patient receives radiotherapy, they are likely to get radiation pneumonia after that. And others including the immunologic injury and drugs. So it's very important for us to confirm the causes of the pneumonia. That's because the causes is associated to the therapy for the pneumonia patients. And now, let's think about this question. Why did the pneumonia occur? It's about the pathogenesis of the pneumonia. There are 3 factors take part in the development of the pneumonia. The first one is the pathogens, including the bacteria, virus, fungus, and so on. For this factor, we need to pay attention to the bacterial virulence to the host and their tolerance to the antibiotics. The second one is about the route of infection. The pneumonia patients are likely to be infected through many routes, including the air inhalation, dissemination with blood, stream spread by adjacent site infection, or aspiration. The third one is about the host factors. If a patient be with immunodeficiency, for example, the HIV infection, or be with underlying disease, for example, the diabetes, those patients are likely to get pneumonia, especially an opportunistic infection. Yeah, those are the pathogenesis of the pneumonia. And I think it's difficult for us to understand, right? And is it important for our clinical work? Yes, in fact. Because according to the pathogenesis of the pneumonia, we can think about the second question. How to prevent pneumonia? Let's try to find the answer to this question during the pathogenesis of the pneumonia. About the pathogens, we can do appropriate environmental disinfection to download the concentration of the microorganisms. And it's also important for us to provide appropriate anti-infective therapy to the patients with any kind of infection, so that there will be less drug-resistant microorganisms. And finally, the vaccine is very important. For example, we just learned about that. The pneumococcal vaccine is very important for the COPD patient to reduce the acute exacerbation and combining pneumonia. About the route of infection, the hand hygiene is very important for us to reduce the risk of the cause infection in hospital. And about the respiratory isolation is the most efficient way to control the epidemic of the novel coronavirus pneumonia. And for some special patients, we need to avoid aspiration to prevent pneumonia. For example, the patients with a paralysis are likely get aspiration. And about the host factors, we need to ask the patient to keep warm and provide a nutrition supporting treatment. And we also need to avoid unnecessary usage of the glucocorticoids and immunosuppressors so that we can try our best to prevent a pneumonia. And I think you can find other methods to prevent pneumonia according to the pathogenesis of the pneumonia. The pneumonia patients can be divided into different groups. There are 3 methods of classifications for these pneumonia patients. One is the anatomical classification. The patients of pneumonia can be divided into 3 groups: lobar, lobular, and interstitial pneumonia. Another one is about the etiological classification. According to the different causes, the patients can be divided into different groups, such as viral pneumonia, streptococcal pneumonia, and so on. And about the third method of classification, according to the circumstance acquired, the patients can be divided into 2 groups. One is the community-acquired pneumonia. For short, it is CAP. And another one is the hospital-acquired pneumonia. For short, it is HAP. And now, I have 2 questions for you. The first one, which method of classification do you think is the most important one? A, B, C. Which one do you want to choose? Yes, the answer is B. Etiological classification is the most important one. Why? Because according to the different causes means that we can confirm the causes of the pneumonia, right? So, it's easy for us to choose the therapy for these patients. For example, if a patient was infected by the streptococcus, we can search the antibiotics in our textbook, and we can find that several drugs can kill these bacteria, and we can choose any one of them for the patient, and it's likely to work, right? But before the classification start, we need to confirm the causes of the pneumonia by some auxiliary examinations. For example, the sputum culture and blood culture. But we usually get false negative results from these tests because of the low percent of positive results from the bacterial culture. And that's why many of the pneumonia patients cannot confirm the causes of their pneumonia. And that's why I have another question for you. That is, Which methods of classification do you think is the most practical one? A or C? Yeah, the answer is C. Let's look at another page. This page shows the epidemiological investigation of the passenger spectra in CAP, and this figure shows the meta-analysis of passengers in CAP. From this figure, we can find that the pneumonia patients were likely infected by streptococcus, atypical passengers, and Haemophilus influenzae. But the proportion of the virus between Chinese and non-Chinese group is different. That's because the Chinese doctor neglected the tests for the virus several years before. So, according to the meta-analysis of the epidemiological investigations, we can find that the patients with CAP are likely to be infected by the streptococcus, atypical passengers, some drug-sensitive gram-negative bacteria, virus, and so on. So, we can choose some antibiotics for these drug-sensitive bacteria for the initiate anti-infective therapy. For example, the penicillins, the first and second generations of the cephalosporin, microlides, quinolones, and so on. About the HAP, we can find that many of the patients will be infected by the drug-resistant bacteria and fungi. For example, the E. coli with ESBLs and MRSA. In this condition, we need to choose some antibiotics for these drug-resistant bacteria and fungi for the initiate anti-infective therapy. For example, the third and fourth generations of the cephalosporin, and sometimes we also need antifungal therapy for this HAP patient. Now, let's move to the clinical manifestations, including the symptoms and signs. Most people with pneumonia will get cough, sputum, and fever. The cough must be new occurred or exacerbated. Just think about this. If a patient got a chronic cough, can we suspect a pneumonia for this patient? No, we cannot suspect the pneumonia for this patient, but a chronic bronchitis or COPD. And the sputum usually be purulent and sometimes with blood. That's because of the white blood cell transmitting into the alveoli for killing the microorganisms. About the fever, the level of the fever is associated with the virulence of the microorganisms and the condition of the host. For example, the virus usually causes a high fever, and an old age patient usually gets a mild fever. Sometimes, some patients maybe get chest pain. And why? Yes, that's because of the infection spread to the pleural membrane and finally cause a pleural effusion. And sometimes, a few patients maybe get dyspnea. That's because of the hypoxia and respiratory failure caused by the severe pneumonia and ARDS. Others, such as the flu-like symptoms caused by the virus and atypical pathogens. About the signs. For the patient with mild pneumonia, we usually can find the increasing of the temperature during the vital signs examinations. And in the physical examination of the lungs, we sometimes can find the increasing of the parameters, the change of the percussion sound, and abnormal bronchial breath sound. Those positive signs are caused by the lobar consolidation. During the auscultation, we usually can hear the crackles in both lungs, which caused by the acute inflammatory exudation. If the pneumonia patient combined with the pleural effusion, we can also find some positive signs caused by the pleural effusion. For example, the decreasing of the parameters, and sometimes we can find the positive signs of the pleural friction sound. Sometimes, if the patient got a severe pneumonia, we can also find the decreasing of the blood pressure and cyanosis caused by the hypoxia. Once we collect enough information of the symptoms and signs from the inquisition and physical examinations, there will be a suspected initial diagnosis. And next, we need to arrange some auxiliary examinations for the patient to confirm our initial diagnosis. Let's look at the radiologic findings firstly. I will show you some pictures of X-ray and CT scan for the pneumonia patients. Let's look at the first picture. It's an image of X-ray for a pneumonia patient. As the red arrow showing, we can find some cloud-like opacity in the right lower lung. And in the CT scan, we can find this cloud-like opacity in the right lung. Those are the air-space opacities. And the diagnosis for these images is lobular pneumonia. Let's look at another two pictures. In this X-ray, can you find the boundaries of the opacity clearly? Yes, as the red is showing, we can find the boundaries of the opacity, and the location of the opacity is in the mid-lobe of the right lung. About the CT scan, we can also find the boundary of the opacity clearly in CT scan. Furthermore, in the opacity, we find some black checks. What are those? Those are the bronchi, and this special sign is called air bronchogram. It's a very special sign for the lobar pneumonia. Let's look at this picture. We can find some unclear opacity in both lower lung. And the CT scan, we can see some frog-like opacity in both lungs. Those are the ground glass opacity, and we can diagnose a interstitial pneumonia. Here shows another X-ray image. In this picture, we can find a hole in the right lung. It's a cavity. And in CT scan, we can also find another cavity in the left lung. In both cavities, we can find a level here and here. Those are the air flu level. Both of the image shows the abscess. About the laboratory findings, we usually need to arrange some laboratory tests for different purposes. The first one is for assessment. If we want to assess the level of the information, we can test the white blood cell count, CRP, ESR, and PCT for the patient. About the severity of the pneumonia, we need the test of the artery blood gas analysis and other laboratory tests. Before we start the therapy for the patients, we need to choose appropriate antibiotics for the patient according to the liver and kidney function. Another purpose of the laboratory tests is to search for the pathogens. We can do the sputum smear and sputum culture. This picture shows the sputum culture. What else including the blood culture and other blood tests? For example, we can test the antibody of the virus and microplasmas in blood or urine, and PCR test for the DNA or RNA of the pathogens. That's the auxiliary examinations for the patient. And now let's move to the diagnosis. Firstly, let's review the steps of the systematic diagnosis of the disease. Step 1. To confirm the initial diagnosis. Step 2. To assess the pathogens and severity of the pneumonia. Step 3. To search for the complications and comorbidities of the pneumonia. Step 1. To confirm the initial diagnosis. Here shows the diagnostic criteria of the pneumonia. There are 5 points, including the contents of the symptoms, signs, laboratory finding, and radiologic findings. Now, please take out your hand and try to follow me and try to remember these 5 criteria of the pneumonia in mind, okay? Okay, firstly, we need to remember the point 5. Radiological finding. It is the parenchymal infiltration or interstitial change in both lungs. We need to remember that the point 5 is the necessary criteria of the pneumonia. And another 4 points, including the 2 symptoms. One is the cough and sputum. The second one is the fever. And one sign is about the bronchial breath sound in abnormal area or crackles in both lungs. And one laboratory finding. We can find the increasing or decreasing of the white blood cell count with or without shift to the left. If the patient fit any one of point 1 to 4 plus 0.5, we can suspect a pneumonia. And now I have a question for you. Do the tuberculosis or lung cancer fit this criteria? Let's look at the tuberculosis firstly. We usually can find the opacity in lungs of the tuberculosis patient, especially in the upper lungs. So, the TB patient will fit 0.5. And about 0.1 to 4, the TB patients usually get cough, sputum, and fever. Especially, the fever is mild and occurs in the afternoon or at night. So, the tuberculosis patients will fit the diagnostic criteria of the pneumonia. About the lung cancer, the patients usually have opacity in lungs and fit 0.5. And the lung cancer patient usually get cough and sputum. So, the lung cancer can also fit this diagnostic criteria of pneumonia. And that's why we need to add some more information to complete the formula of the diagnostic criteria of pneumonia. If the patient fit any one of the 0.1 to 4 plus 0.5 with excluding differential diagnosis, in this condition, we can confirm the diagnosis of the pneumonia. If a patient got infection in community and fit the diagnostic criteria of pneumonia, we can confirm the diagnosis of CAP. And the criteria of HAP is similar to CAP. To fit hospital-acquired and fit the diagnostic criteria of pneumonia. The differential diagnosis of pneumonia include tuberculosis, lung cancer, other non-infective disease, and so on. We also need to arrange some auxiliary examination for this differential diagnosis. For example, we need PPD test or sputum smear, sometimes biopsy, to scan the tuberculosis. How to build the regime of differential diagnosis? We just talked about this question in the last class of COPD. And now let's do a review. There are two methods to build regime of the differential diagnosis. One is according to the abnormal symptoms. Another one is according to the abnormal findings in auxiliary examinations. For example, if a patient got cough and sputum for just several days, we need to think about the suspicion of pneumonia, bronchitis, upper respiratory tract infection, and so on. And if another patient have air space opacity in lungs, then we need to exclude the diagnosis of pneumonia, tuberculosis, lung cancer, cough, and so on. That's the first step to the diagnosis of pneumonia. Step 1, to confirm the initial diagnosis. Step 2, to assess the pathogens and severity of pneumonia. Firstly, we need to arrange some auxiliary examination to assess the microorganisms of the pneumonia. We need sputum tests or blood tests for different patients. For all the patients with sputum, we need to arrange sputum tests for them, including the sputum smear and sputum culture. Sometimes, some patients may be with little sputum. In this condition, we can collect respiratory exudation through the bronchoscopy. And if the patient got a fever, we need to arrange blood culture for them. For example, the PCR test of the RNA is required to confirm the diagnosis of the novel coronavirus pneumonia. And sometimes, if there is a suspected viral infection or mycoplasma infection, we need to do some other blood tests for them. And another assessment of the pneumonia is about the severity of the pneumonia. This table shows the criteria of the severity pneumonia. It's complicated, and let's try to understand it and try to keep in mind. First one, there are two major criteria for the severity of pneumonia. Just think about this. Pneumonia is an infective disease, right? If the infection cannot be controlled and become more and more severe, the patient are likely to get a septic shock. That means the decreasing of the blood pressure and need for vasopressors. So that's the first major criteria. About another major criteria. We just talked about that. A few patients with pneumonia maybe get dyspnea. That's because the pneumonia can result in respiratory failure and ARDS. So, if a patient of pneumonia get a respiratory failure and need for mechanical ventilation, we can also diagnose a severe pneumonia, and all of these patients are likely die. Another 6 minor criteria, including 3 increasing, 2 decreasing, and 1 mental confusion. We can try to remember these 6 minor criteria. Follow this formula. 3 increasing of the respiratory rate, urea, and the lung opacity. 2 decreasing, including the decreasing of the partial pressure of the oxygen, and the blood pressure do not need for the vasopressors. And 1 mental confusion. So that's the step 2 to assess the pathogens and severity of the pneumonia. Step 3, to search for the comorbidities, including the respiratory failure, septic shock, and systematic abscess, acid-base and electrolyte imbalance, and other combining disease. That's the systematic diagnosis of the pneumonia, including 3 steps. And now let's move to the treatment.